Dianne Ferdinand Walcott, District Medical Officer for the community of Grosley.
Dr. Walcott, how long have you been in this job position?
I've been a District Medical Officer for the past 3 years, and I've also served at some health centers, Moshi and Triple.
Can you please briefly tell us what your job entails in relation to older persons?
Okay, so on a day-to-day basis, we see several elderly patients who may come in on their own depending on their level of independence or with a caretaker. And we have this face-to-face contact with them. We review them. Most times they come for their prescriptions, but other times they have underlying issues that we help them manage at home.
Dr. Walker, in your job experience being the District Medical Officer for the North, have you encountered older persons being abused or neglected in any way?
I have encountered some older persons being abused. Although it is few and far between, there have been cases of neglect, there have been cases of physical abuse, but primarily of neglect. There may be underlying reasons, but yes, I have seen a few cases.
So in your work experience, please share a personal experience where you have dealt with an older person being abused or neglected.
So in my job, sometimes we're required to do home visits. And so I was asked to do a home visit for a client, and when I got to the house, the patient was bedridden, and the bed sores were at a very advanced stage, where not much could be done. The person had to be transferred to the hospital and eventually succumbed to his injuries. And I think if medical assistance had been sought earlier, then we may not have had a different outcome. It's hard to tell, but there is that possibility.
Having had such experiences, what would some of your personal challenges be in dealing with abuse and neglect of older persons in St. Lucia?
So challenges would be, one, that not every person has someone to take care of them. Not all the elderly persons have people who are willing to care for them. And so they have a challenge with meeting their basic needs. Some of them I speak to, all of their children are overseas. And so if they get into an accident or minor injury, it becomes a major thing when they are not able to seek medical assistance in a timely fashion. Another thing with neglect, we can see, or even emotional abuse, even the children that take on their elderly parents, sometimes you find that they limit their activities. It's almost like they start treating the parents as if they were children. And I'm talking about people with their sound mind and people who are able to make decisions. They may not be physically up to par what they used to be, but their mental capacity is appropriate, and they are legally able to make decisions, whether it be financial or decisions concerning their friends, their social interactions. And to limit these persons to a locked room, or saying your friends cannot call you, or any of these things that the children or friends may do, the caretaker may impose upon them, would be detrimental to the patient's psychological and emotional health.
So tell us, Dr. Walcott, what are your personal feelings with respect to these challenges?
My feelings with respect to seeing abuse, hearing of abuse, because we have certain homes for the elderly that could be much better. You have stories, I have colleagues who visit these homes, and the state could be a lot better. I know we're doing the most that we can, but I think we can get some sort of incentives or assistance in that regard to at least show the persons that their life continues and they're not just waiting to die, that they can be taken out on maybe trips or just for a ride, for a drive around the place. Maybe I know these days situations, COVID has all its restrictions, but even to play a game, a card game, or to have some level of activity to keep the person's mind alert and looking forward to the next day instead of just staring at a blank wall. I think all of these things can be improved in small ways. It doesn't have to be extraordinary ways.
Having said that, would you have any recommendations for the general public, government, and persons working directly with the elderly as to how we can deal with these challenges of elder abuse and neglect?
I believe that as an official caretaker, you have to be trained specifically with working with the elderly. The elderly, they need to be listened to just as you would like to be listened to. It doesn't mean that their voice is diminished. It may be softer, but is just as independent as when they were of their working years. I believe that that they need to be listened to, they need to be appreciated, they need to be shown the respect that they deserve. And if it comes to the point where the caretaker feels that they are not able to manage, it's fine, it's okay. Everybody goes through it. Especially if you have an elderly person who's holding on to their independence and you're seeing that they're not able to make the decisions that they need to make, or you find another family member is maybe asking them for money or abusing them in that way, you may have to come in and speak with the person, maybe seek help from a medical professional or the law, as the case may be.
I'm hoping that with your help as the district doctor for Groseille, that we can get some more guidance, we can get some help, medical help, when it comes to older persons being abused, whether physical or otherwise.
I hope so.
So we're very grateful for your sharing today.
Thank you, it was my pleasure.
This is part of a series of interviews highlighting the awareness of elder abuse and care of older persons, especially in St. Lucia. Do stay tuned to our next interview with Claudia Louis, Home Care Supervisor within the SSDF Home Care Department. I am Andrea Alcide, Family Caseworker for the Elderly within the Division of Human Services of the Ministry of Equity, Social Justice, Local Government and Empowerment. Thank you.